Pain or pins and needles or burning in the hand, especially these fingers, sometimes that one too, could be carpal tunnel syndrome. And this is something that we often see in practice. And I want to talk to you about it in terms of what it is, but also what it might be that you don't realise. What I mean by that is it's often misdiagnosed. Carpal tunnel syndrome is to do with the median nerve. So the median nerve comes from the neck and it goes down the arm and it goes to, can you see that branch there? It goes to the thumb and the forefinger, and then sometimes a little bit to this finger as well. So that tends to be where you feel it. And the symptoms, are often like a burning or especially a pain in these fingers. Sometimes it goes up the forearm as well. The carpal tunnel it's like a groove between two bones called the carpal bones. Got 8 bones in the wrist called carpals, and the median nerve goes through that groove. So technically, the true carpal tunnel syndrome is when that groove, that space for the nerve, closes up. Now, it could be due to scar tissue, or it could be due to swelling or inflammation around there, or arthritis. And if you go and see a surgeon about it, a hand surgeon, so a surgeon's one question, of course, is always, do I need to operate on this person? They want to know whether or not it is coming from there. What we often find in practice is we'll get people coming to see us who have all the symptoms of carpal tunnel syndrome, and it might be partially to do with the wrist, but it's also connected to the neck. And if that's the case, then that's the kind of thing that we can help with, because we treat the neck. We also mobilize the wrist as well. But if this nerve is being pinched up in the neck, then it's already compromised by the time it gets to the wrist, which means it's not going to take all that much to compress that nerve down there. And they call that a double crush syndrome, meaning it's being squashed in more than one place, which means it doesn't stand a chance. An analogy that we often use is think about a garden hose. So you've got a garden hose with water going through it, and if you kind of step on it a bit and crimp it, it won't make all that much difference to the flow of water. If you do that in 2 or 3 places, though, the flow of water is going to significantly reduce. And it's kind of like that with nerve signals. If it's already been compromised at the neck because you've got an issue here, so you've got less space between the bones in the neck, or inflammation, or some other issue that's compressing the nerve, then by the time it gets to the wrist, it doesn't take much more compression to start getting those carpal tunnel symptoms. So this is also another reason why some people have carpal tunnel carpal tunnel surgery and it doesn't improve. It's because it was only partially to do with the wrist. It was actually connected with the neck more so. But you've got to find out which one's which. Often it's both. So this is the kind of carpal tunnel syndrome that we can help with. Anything that's connected with the neck. I'm treating a couple of people with this at the moment. We usually get very good results. At the end of the day, some people do need surgery, but for the most part, if we address the neck and mobilize the wrist at the same time, usually the symptoms improve considerably. So if you've got any questions about that, stick them in the comments, and I'll see you soon. Take care.